Preventing infection after open heart surgery. How long will I be immune compromised after surgery? The clinical significance of one study is that despite apparent recovery from heart surgery, the immunological aftermath continues for at least 3 months and potentially longer. How long after surgery can you get an infection? Most surgical wound infections show up within the first 30 days after surgery. Surgical wound infections may have pus draining from them, and you can be red, painful, or hot to touch. You might have a fever and feel sick. How common is infection after open heart surgery? Infection is a possible complication of surgery. A small number of people who have cardiac surgery, between 3 and 6%, will develop an infection. This may happen shortly after surgery or many months, even years later. What can happen if you get an infection? Infections of any surgical wound is serious business. After heart surgery in particular, such an infection could be life-threatening. As surgical site infections account for 31% of all hospital-acquired infections, it's critical to take steps to reduce your risk. So, signs of infection: a fever, including feeling hot and shivery or having a temperature of 100.4 or above. Unexplained weight loss, cough or increased shortness of breath, waking up with bed sheets showing signs of sweating, joint or muscle pain, feeling sick or vomiting, feeling unusually tired, pain, redness, warmth, or pus around where you had your operation. Causes of infection. A possible source of infection is in a very small number of people who have open heart surgery is a bacterium called Mycobacterium camieria. This bacterium has been found to contaminate the water tanks of a medical device called a heater-cooler unit. Can I catch this infection from someone else? No. Another cause of infection is a bacterial or viral infection that can come from another person. So how to avoid infection? 1, take antibiotics. 2, lose weight if needed. You have a greater risk of developing an infection if you are overweight. 3, monitor your blood sugar if needed. In the weeks leading up to your surgery, monitor your blood sugars up to 4 times per day. Drink plenty of fluids and call your doctor if your blood sugars are constantly over 250. The better controlled your blood sugars are before surgery, the lower your risk of developing an infection. 4, take care of your wound. Before the surgical team discharges you from the hospital, they will teach you how to care for your wound. That's critical in preventing a wound infection. You'll receive discharge instructions, so be sure you understand them and ask questions if you don't understand. Always follow your doctor's instructions for bathing and showering, and never hesitate to call your doctor with any questions. Wash your body daily with antibacterial soap, and brush your teeth 3 to 4 times a day. What happens if you get COVID-19 after surgery? In most cases, full recovery after heart surgery takes a few weeks. More complex surgeries may require several months. Now, the COVID-19 pandemic has changed nearly every aspect of daily life, including how patients recover from heart surgery. While you're recovering, it's important to follow the instructions given to you by your surgical team. It's also crucial that you take precautions to guard against COVID-19, which has proven to be more dangerous for people with heart conditions. By taking a few extra precautions, you'll increase your chance of recovering safely and returning to good health during this pandemic. Remember to wash your hands often, either with soap and water for 20 seconds or hand sanitizer that contains at least 60% alcohol. Avoid contact with people who are sick. Stay at home as much as possible. Cover your mouth and nose with a face mask if you are around others, and stay at least 6 feet away from them. Clean and disinfect objects and surfaces you often touch.